Post-menopausal bleeding. What causes it? Should we be afraid if that happens? How to fix it? Maybe even how to prevent it? Let's talk about it. So, I'm Dr. 𝐤𝐤𝐤𝐞. Welcome to the channel. If this is your first time here, welcome. I do want you to try and subscribe to the channel so that you don't miss any videos that we're going to upload. We talk about hormones here, we talk about weight loss, we talk about everything, okay? So let's get started. So today's topic, we are talking about post-menopausal bleeding. This is something that a lot of women that experience it is a little scary, because let me explain what this means. So you've been having periods all your life, and all of a sudden you get to this age where we call menopause, and for everybody that's different. Some women experience this in their 40s, some in their 50s, some in their late 60s. I mean, we get to menopause when our ovaries stays and we get to menopause, right? And we're all born with different amount of eggs and different genetics. So menopause is not this magical number of 50, because I usually hear a lot of women worry if they get to 50 and they don't hit menopause yet. I'm like, your ovaries is not done. It's still got some juice in it, okay? So anyways, what I'm saying is, once you hit this age where it's menopause for you, okay, what that means is that your ovaries are no longer producing enough hormones to meet your daily requirement. And for a lot of women, one of the signs, telltale signs of that happening is their period, their monthly cycling stops. And they stop having periods, and so women are like, hallelujah! They're so excited. They don't ever want to see that red thing again every month. They're like, no more tampons, no more pads, I'm done with that, yay! And they go on, they're enjoying their life, and all of a sudden, one day, they just see spotting. And out of nowhere, they have a full period, or maybe just a couple of days of spotting, maybe saw their clothes, their underwear, or whatever it is, just out of nowhere. And when this happens, this is something you really actually do need to call your doctor about, okay? And the reason why we worry about this is that when your ovaries have reached a point where they have surgically or medically or naturally reached menopause, the things that cause bleeding after that are usually things that we have to investigate, okay? And one of the most scary ones, let's just talk about it right away, is cancer. So if we see post-menopausal bleeding in women, we usually have to do the workup immediately to rule out cancer. So when a woman sees this, this is why we don't want you to like explain it away, okay? Immediately call your doctor. Sometimes we have to do an ultrasound, transvaginal ultrasound, or some other imaging. Sometimes we have to do a biopsy, DNC, whatever we need to do to really take a sample of this tissue and find out why it's bleeding, okay? So that is the most scary part, and this is why we have to immediately check. The other times we might see post-menopausal bleeding is in patients that are receiving hormone replacement therapy. So we talk about that a lot in this channel, whether it's bioidentical hormone replacement therapy, whether it's synthetic hormone replacement therapy, it doesn't matter. But some type of hormone replacement therapy that you're on might have caused you to have this bleeding. So we usually recommend that if you see post-menopausal bleeding while you're on hormone therapy, you also need to call your doctor. Okay, because we have to go through some questioning to try to figure out, maybe we can explain why, okay? So one of the most common things that some of my patients have done that have caused it is they forget to take their progesterone. So progesterone is one of the hormones that women usually would be depleted in at menopause, that we sometimes replace with a pill that we have them take at bedtime. And the reason why we have them take progesterone as a pill at bedtime is because it is one of the hormones that actually helps with sleep. And if you have this pill by your bedside and you forget to take it a few nights, maybe you traveled, you were on a cruise, you forgot to pack it with you, and you just missed a few nights, you would think, oh, no big deal, I'll get back to it when I get back, things will be all dandy, right? Well, what has happened during this time while you were gone? You've been receiving estrogen replacement, which is good, right? We've talked about all the things estrogen does and why it's important. But now you don't have the opposing hormone that's supposed to keep that in check. It helps to balance themselves, right? So now, because you haven't been taking the progesterone for a few days, you've allowed the estrogen to have a free time to do whatever it wants for 3 days, 4 days, or however long days you've missed it. And all of a sudden, your body is having the withdrawal bleed when you get back. So now we're saying, this might be something serious, or it might just be, oops, I forgot to take my progesterone. And in these patients, if they're able to tell me this history that, oh yeah, I missed my progesterone for a week, well, we can easily get back on board, get that back on board and see if the bleeding stops, right? So that's easy, right? We miss your pill, we replace it. And there's the other patient that maybe they've been dosed way too much with estrogen, right? If we give someone way more estrogen than their body really needs, and we don't have enough progesterone to balance it, then this can also happen. So this is one of the reasons why in our previous videos where I was explaining the fact that we need lab testing to really check how much we're giving the patient, make sure we're not underdosing, overdosing. For patients that are going to clinics or practitioners that are not checking their levels ever so often, this can happen, where you've just been given the same amount of estrogen every time you go, or you've been prescribed just to take one pill every day, or rub this much cream on every night, and nobody's checking, and they just keep refilling it every time you go for your appointments. They're like, you need refill? You say yes, they just refill it, and you just keep taking. Well, maybe your body will at some point needed a lower dose of the estrogen for this time period, but it was never lowered. So now you just have way too much estrogen floating in your bloodstream, and that has thickened the lining of your uterus, and voila, you have a bleed. Okay, so this is something that has to be monitored, because once the lining of that uterus thickens, well, now there's additional investigation that we have to do to make sure that this is not cancer, this is not. So it just starts a whole kind of worms, right? Rather than just be preventative in the first place and just check the levels, make sure it's optimal, you're not overdosing, you're not underdosing, and you're balancing things all throughout. We're balancing things. This is hormone replacement therapy. Should have an extra word behind it, balancing. It's got to be a balance, and it's different for each patient, and it has to be done tailored to you. So just having one pill that you've been on for 10 years and nobody's checking, probably not a good idea. Okay, so you do need to have levels checked. You do need to see if the FSH and the LH are getting suppressed, showing that the brain is sensing that you have enough hormone in your bloodstream. And sometimes if this is overly suppressed, that can sometimes be a sign that we're giving you too much hormones and we need to back off. And so we use those things to kind of gauge when we need to pull back, when we need to add, when we need to subtract, and make sure we're balancing things for you. Okay, because sometimes during the stressful time of the year, maybe you got a lot going on, in-laws, grandparents, kids, stress, life, the hormones might need to be balanced differently during those times than when things are just easy peasy and going smooth and no lumps and bumps in the road, you know. So those are things that we have to always address to make sure that we are keeping things balanced, okay? So some comments in the section below if you've had any horror stories, or hopefully not, or funny stories, or anything that's happened during your hormone replacement journey period that you would like to share and use to help educate or entertain the rest of our audience. All right, good seeing you guys. I'll see you on the next one. Don't forget to subscribe.